day 3 of the Great New York State Fair. We do have a very important topic to talk about, a disturbing new trend we know are sending people all over the U.S. to the hospital. Now, more than 150 cases of lung disease believed to be associated with vaping, and that's being investigated in 16 states.
This is serious stuff. 15 of those cases are in upstate New York. Christine Stork, the clinical director of the Upstate New York Poison Control Center, joins us. We appreciate you being here. We knew vaping was a teenage epidemic, but this lung disease linkage is really troubling, isn't it?
Yes, it's new. The cases have been coming in since June, and it really is quite concerning.
What happened? What is causing the lung failure in these young people?
Well, unfortunately, that's still being investigated. The cases are being identified. We're asking people to report those cases to the Poison Control Center, and that is in collaboration with the state and the CDC and FDA. We're looking to try to identify what exactly in some of these vaping products is causing.
There's an association, but you haven't necessarily made a link between vaping itself and these cases of lung?
There is an association, but there is no causation quite yet.
And can you talk about just the risks associated with vaping?
Yeah, well, vaping contains nicotine, which clearly can cause addiction, and that has always been a problem. But in looking at the other health risks, we have to look at the excipients, the other things that are in vape fluids, other things that people are vaping, not just nicotine products, but marijuana products, CBD products, synthetic marijuana-type products all have risks associated with them. So globally, it's become quite an epidemic.
Go ahead,
And
Jim.
yeah, why has this become so popular with teens? Is this the way it's being advertised? We hear all the time that teens are really getting into this vaping.
Yeah, I mean, I think it is partially the advertisement. I mean, we see a lot of new regulations in terms of the flavoring agents. This doesn't smell like smoke would, you know, back in the day when I was growing up. So I think it's just a new fad that's come through, and a lot of teenagers think it's safe.
And they think it's harmless, and they can hide it well in school or wherever they're using it, right?
Right. It's a real, you know, some of them are really small cartridges. They look like they're USB port drives, so it's really hard to identify.
How does the Poison Control Center get involved? If someone becomes ill as they're vaping or using an e-cigarette product, what should they do?
They can, it depends how sick they are, but if they don't have a life-threatening effect, they can call the Poison Control Center. Perhaps you have the number here, but you can call them. You can, you know, the healthcare facilities are also calling us. We're asking any healthcare facility that has a lung injury case to please call the Poison Center, because we're collecting the data.
Well, there's the number. Write it down and save it if you need it. 800-222-1222.
And quickly, what advice would you give to parents who might be dealing with this issue with their teens?
I think you really need to talk to teens about vaping, about the potential harms of vaping, and be realistic. You know, it's not going to kill you when you take your first puff. And I think if you really use realism and tell them exactly what the risks are, that would be more helpful.
And the problem is, for adults who have been hooked on cigarettes, it can be a way to get off cigarettes, right, with a little lower level of nicotine.
Yeah.
But for kids, it can get them hooked, or worse.
Correct. It can get them hooked, and now there's some data showing, again, the excipient's a problem. It can lead some teens into smoking cigarettes later as well.
And now there's possible association with lung disease. Look, let's look at that number again if we can. The Poison Control Center of Upstate New York, Dr. Christine Stork is the clinical director. 800-222-1222 if you need their help. Thank you, doctor.
Okay, thank you so much.
Thanks so much for being here.